Fibromyalgia symptoms and mental health. Have you ever looked at a list of fibromyalgia symptoms? Looking at these two websites, you will see both anxiety and depression listed as symptoms. Here are two reputable websites as proof: Chronic Illness and Chronic Woman. In fact, it seems that fibromyalgia symptoms and mental health are very much linked together. One could say that fibromyalgia is like a spider web, with so many facets, co-morbid conditions, moving out from the center. Our mission: connection between fibromyalgia symptoms and mental health. Part of our mission is to ask questions about fibromyalgia symptoms and mental health. This series is to showcase the connection between fibromyalgia symptoms and mental health. Is mental illness, in part, a cause of fibromyalgia? I wonder. In part 1 of Fibromyalgia and Mental Health, I told you my story. Read that here. Now, I would like to introduce you to Cathy. She is 20 years old and is fibromyalgia and mental health warrior. I think you will be able to relate to her story and find comfort in her advice. Tell us about getting diagnosed with fibromyalgia. I was diagnosed with fibromyalgia in June 2018. I had been back and forth to my doctor's practice with various different symptoms for many years prior to my diagnosis. As a young teenager, I never knew why I was struggling so much and why I had so many different health issues. High school education, college education, and my social life have been affected due to my health since I was 13 years old. It was when my mom, who has fibromyalgia, had mentioned to me that the problems I was having were similar to her symptoms. Then I started to think that the illness had been passed on to me. Fibromyalgia symptoms and mental health. General physician. The first time I spoke about FM at a doctor's appointment, I was told, "Oh no, you don't want that." There was not much more was said about it. I had a blood test and the results came back okay. I was told that it would show up there if I had FM. Later on in life, I found out this was not true. It took me around 5 years, give or take, to be diagnosed. At this point I was telling people I already had FM because I knew as my health worsened, that is what I have. Seeking answers. So at the start of 2018, I made a doctor's appointment again with my GP solely to ask him to refer me to a rheumatologist. As a friend with FM said, that is who had diagnosed her. At the appointment, I had to keep reminding the doctor that I was there to be referred to see a rheumatologist, and I felt I had to pretty much beg to him agreeing to refer me to see one. He wanted me to just go back on antidepressants and go back to counseling. Advocating. I kept telling him that I am struggling with the pain and had to be off sick from work, and after so many years of struggling. I want to know if I do have FM, so I would like to see a rheumatologist. He kept coming back to the "it's all in your head" comments, and why would you want to be diagnosed with something like that? And I ended up being prescribed fluoxetine in return for being able to see a rheumatologist. Not the right doctor. I never went back to see the same doctor as I didn't feel comfortable talking to him again. After telling my mom, she told me that she saw the same doctor about 30 years before and he was pretty much the same as her. Fibromyalgia symptoms and mental health. Rheumatologist. I got a letter in the post with my rheumatology appointment, which was 5 months away. The rheumatologist asked me questions about my symptoms and my history. He said that since my mom also has been diagnosed, it had been passed on to me. Validation. After about 15 minutes, he did some physical examinations and turned to me and said, "Well, you definitely have fibromyalgia." He spoke to me about treatment and he told me that most medication will only reduce pain by about 50% if it does at all. I told him I understand that there is not a lot that can be done, and he also told me that I do not need to take fluoxetine anymore, as I said it had only negatively impacted my mental health and not eased any other symptom. He assured me that if I don't feel comfortable taking medication, I don't have to. The rheumatologist was very informative and understanding, even though I had come out of the hospital with a diagnosis of a horrible illness. I felt I finally understood why I was different and why I had been so ill for so long. How old were you when diagnosed with a mental illness? Most of my time at the doctor through age 14 until about 18 was due to my mental health. I wasn't going into high school or barely leaving the house and saw multiple counselors who told me I had depression and social anxiety. Medication journey. I was given antidepressants at a young age. They only ever gave me fluoxetine tablets, which made me feel numb and did not help with my symptoms. I didn't feel I had any emotion each time I took them and didn't feel that specific medication benefited me. For some reason, I was never offered anything different other than that same medication and to see a counselor. Even at times when I had said I want to try something different, it made me feel like I was just going down the same path, over and over. The doctor who had referred me to the rheumatologist had also told me I could only be given 3 antidepressants, which I later also found out wasn't true, as I was given tricyclic ones. Fibromyalgia symptoms and mental health therapy. At the age of 18, I had seen a counselor again, but as I was now an adult, I could only have 6 sessions and that would be it for the time being. I spent most of my time explaining childhood trauma to her, how I had been abused, and constantly talking to her about how I am not being taken seriously.